Hi everyone, Dr. Manjula here. I am again back with another set of previous year question paper discussion for AIIMS NORCET as well as other central government jobs. So in this video, we will be discussing not just the question and its answer, but we will also be discussing the options, why it is wrong, and so that you get a holistic view of the core contents that is being covered in these kind of central government examinations. So please watch till the end for a more holistic approach to the question paper. So let's begin. So the first question is, trans illumination procedure is done in which of these conditions? Sinusitis, or angiography, blood culture, or bone marrow aspiration. So trans illumination is done in sinusitis. So what is trans illumination? Actually, you are using a torch or a light source, and you shine it through the body tissues to observe abnormalities based on the light's passage. Now in sinusitis, what we can understand is when we are passing the light, see in this picture you can see that when we are passing the light through the sinus, we can identify the presence of fluid or pus inside the sinus. Like if the glow is, normally it glows, okay, it appears as a glow like this, you can see here in this picture. But if there is a sinusitis, it will affect the transmission of the light. It could be reduced or absent because there is fluid or pulse that is blocking the passage of light. So this is actually a very non-invasive method. That is what is so beautiful about this procedure. It is safe, it is quick, and it is non-invasive method, but it is not accurate. So the accurate thing is to take a X-ray or a CT scan. So this is just a safe method of, during the clinical examination, you can safely understand if there is some collection in the sinus. So what were the other options? Angiography. What is angiography? It is used to visualize the blood vessels by injecting some contrast dye and taking X-ray pictures. So it has got nothing to do with transillumination. Okay. So angiography helps us in understanding the blockages or some aneurysms or malformations in the arteries and the veins. Okay. So angiography actually requires the injection of a contrast agent, which is performed under fluoroscopy. So contrast agent, when you are preparing the patients for angiography, so you have to check for the allergy towards the contrast agent, because usually we use iodine based contrast agents. So there can be, if the patient is allergic to iodine, then you should use another variety of contrast agent, not the iodine containing preparation. So that could be a question for you, because it is a very repeatedly asked and very important topic when it comes to preparing patients for angiography. So please keep that in mind. Next option is blood culture. So blood culture is done to detect the presence of bacteria or fungi in the blood. So we drop the blood sample, incubate it in the culture media, and identify the presence of microorganisms. The fourth option was bone marrow aspiration. We extract the marrow from the bones, usually which is the site, iliac crest or sternum. So that you should know that commonly used site, because it has been asked in previous question papers. This is done for identifying hematological diseases, right, like anemia or leukemia, etc. So what do? We have a special bone marrow aspiration needle and we insert it under local anesthesia. Next question, in a 3-year-old child, which of the following is the best complementary feed? Okay, complementary feed that can be given. So for a 3-year child, what is a complementary feed? Mashed bananas, dal rice, fruit juice, boiled soft carrot. So the correct option is dal rice, because at 3 years of age, children can eat most of the family foods, and the diet should also be rich in protein, carbohydrate, and micronutrients. Now, if you look at dal and rice, dal is lentil, which is a good source of plant-based protein. And we have rice, which is again carbohydrate, a good source of energy. So together this will make a meal that is complete, easy to digest, and also it is easy to chew and swallow. So, and it suits Indian children's taste. The other options are mashed banana. Mashed banana is for infants 6 to 12 years, that is during the initial weaning stage. For a 3-year, it is not a good source of complementary feed because it lacks proteins. It just has only energy or carbohydrate and potassium. There is no protein in it. So that is not a correct option. Again, the other option was fruit juice. It is not recommended as a primary feed because it is again high in sugar but low in fiber. Fruit juices are low in fiber. So for small children, it can cause diarrhea, dental caries, and also it displays more nutritious food. So it is always better for a 3-year-old child. It's always better to offer a whole fruit, not the juice. And how about boiled soft carrot? It is nutritious, but it's never a complete feed because it has vitamin A, but it doesn't have proteins or carbohydrates. Okay, so it can be given as it is never given as a primary meal because it's not wholesome. So you can give it along with the primary meal as a side dish or something of that sort. So let us just a brief, this table gives you by age group what are the different complementary feed that you can give. So if the baby is 6 to 8 months, the calorie requirement is 600 kilocalories per day, where you can give mashed banana, porridge or kanji, moong dal soup, vegetable puree, and I would never recommend Cerelac. But sometimes if the child is not able to take the other normal foods, then sometimes it is also recommended. And we have to keep giving breastfeeding plus 2 to 3 times, feed 2 to 3 times daily, and can give one snack, but it should always be soft and mashed. If you're giving bananas, it should be soft cooked and mashed. Then 9 to 11 months, the calorie requirements. See, this could be a question, okay? What are the calorie requirements according to different age groups? So that you should be keeping in mind. So here, 9 to 11 months, you can give khichdi, boiled egg yolk, mashed potato with ghee, suji or semolina, and semolina porridge, idli mashed with vegetables. So 3 to 4 times per day, you have to feed them. By 12 to 23 months, 900 kilocalories per day, you can give dal rice, chapati soaked in milk, vegetable upma, curd rice, scrambled eggs, and chopped fruits. Here also 3 main meals plus 2 to 3 snacks per day. See, as the calorie requirement increases, we have to increase the number of meals as well as the snack. When I mean snacks, it is not the store bought. Okay, it can be a vegetable or a what is that, carrot or something like that you can give. 2 to 3 years, 1000 to 1200 kilocalories per day. Anything that the family eats, you can give, like rice, chapati, dal, vegetable pulao, dosa, idli, sambar, everything. So ensure that protein, iron and calcium are met. 4 to 6 years, 1400 to 1600 kilocalories. So here 3 major meals plus 2 snacks, a balanced diet with the grains, pulses, milk, vegetables, fruits, nuts, everything. That complete diet you can give just like how an adult eats. So encourage self-feeding, avoid junk always, and focus on the growth and development kind of foods. Next question, a child is on continuous positive airway pressure and is hemodynamically stable. Which is the best method of feeding this child? Breastfeeding, nasogastric feeding, cup feeding, IV fluids. So the best method is nasogastric feeding because see, CPAP is used for respiratory support, okay? Often in preterm or ill neonates and infants who are experiencing respiratory distress, right? But they are hemodynamically stable. So here the only option is to give a nasogastric feeding. So the correct answer is 2 because this is very effective and safe. And also you can give breast milk or formula, whatever it is, directly to the stomach in a controlled manner. So the advantage is there is no aspiration happening. If you give oral feeding, then there will be aspiration and it can aggravate respiratory distress. So it is well tolerated and most commonly used in NICUs. Again, it can be given intermittently or continuously using a syringe or a feeding pump. So these are the advantages of an nasogastric feeding in CPAP. If you do a breastfeeding, it is not at all suitable because all this sucking, swallowing, everything is disrupted when the child is in respiratory distress. So they will not be able to do breastfeeding. And also the risk of aspiration pneumonia is high. So once the child is weaned off, then you can encourage breastfeeding. What about cup feeding? It is used as an alternative to breastfeeding or bottle feeding in some cases. But for a child, in this question, CPAP, for a child who is in CPAP, it is not, because it also carries aspiration risk. How about IV fluids? Only if enteral feeding is contraindicated. Okay. So if the child is not tolerating any enteral feed, then you can think of IV fluids. So IV fluids actually provide hydration and some electrolytes, but the balanced nutrition for the growth and development or the recovery in the long term, it will not help. So it is not a best method for in this condition. Especially when the child's GI tract is functional, then we always look for enteral feed, not IV. Next question. In a 4.5 mm endotracheal tube, what is the size of the suction catheter used? So this is a commonly asked question actually. I have kept the answer also here. The answer is 10 French. 10 French. So how do you should, this is a very, very important question. You should know this formula. How do you calculate the suction catheter size? So it is the ET tube size into 2. So for a 4.5 mm ET tube, the size of the catheter should be 9 French. Okay, so in this question, it's approximately, see 4.5 into 2, it is approximately, whatever is in the option is 10 French. Okay, so you can choose that. So the size must allow effective suctioning without blocking the airway. Otherwise, it will cause trauma. So must be very careful in selecting the size of the suction catheter. So yes. How about the other options? 10 French, it is slightly larger than the ideal, because if you use such a bigger one, it will occlude the ET tube and there is a risk of hypoxia during suctioning. Again, 15 French is also too large. It may cause mucosal trauma and airway blockage. 18 French is completely unsuitable. So just if you cannot by heart the formula, then you can at least you can just see this and keep it in your mind. Just take a picture of this and this will help you in the final revision as well. So all the ET tube size, I've given the French. So if the ET tube is bigger in size, you can use 16 to 18 French catheter. Next question. WHO declared COVID-19 a public health emergency on which date? 13th Jan 2020, 30th Jan 2020, 31st Jan 2020, 20th Jan 2020. This is a previous question last year, 2024 NORCET exam question this is. So the answer is 30th Jan, okay, 2020. WHO declared COVID-19 outbreak as a public health emergency of international concern. So this is the highest level of alert WHO can issue under international health regulations. So it was calling for coordinated international response. So just some important dates, that is 13th Jan 2020. The other options, 13th Jan 2020, it was the first confirmed COVID-19 case outside China, that was Thailand. 31st, some countries, especially Italy, declared national emergencies. 20th Jan, China confirmed human-to-human transmission. So these were the other options in the question. So a quick timeline: 31st December, China reports pneumonia of unknown cause to WHO. Then 13th Jan, first case outside China. 20th Jan, China confirms human-to-human transmission. 30th Jan, WHO declares COVID-19 as a public health emergency. 11th March, WHO declares COVID-19 as a pandemic. Next question, the normal interval of QRS complex is? Normal interval of QRS complex is 0.08, 0.12, 0.16, 0.4. So the correct answer is 0.08 seconds. So what is QRS complex? QRS complex represents ventricular depolarization. That is the electrical activity that triggers the ventricular contraction. Okay. So a normal QRS complex duration indicates that the ventricular system or the conduction system, that is from here you can see the bundle of hairs, then the bundle branches and the Purkinje fibers is functioning properly. So that duration shows, QRS duration shows that the system is functioning properly, the conduction system is functioning properly. So in this picture you can always see what happens in QRS complex. The impulses passes through the Purkinje fibers. Now here first the impulses passes through the bundle branches, then the bundle of hairs arrives in the AV node and the node depolarizes, then it passes through the Purkinje fibers. Okay, so QRS complex tells us about the depolarization of the ventricle. So what is the normal duration? It is 0.06 to 0.10 second. So when in this question, the option was 0.08 second, which is well within the normal range. So now if you observe this QRS complex, you can see here that it occupies two small squares. Okay, you know that each one small square is 0.04 second. So because there are two small squares occupied by the QRS complex, it is 0.08 second, right? So two small squares which represents a QRS interval of 0.08 seconds, right? So what were the other options? 0.12 second is like upper limit of the normal. So it shows a slight delay in the conduction. 0.16 second is prolonged QRS. So it could indicate a bundle branch block or ventricular arrhythmias. And 0.4 second is extremely prolonged. Usually it is not possible in QRS complex. So that's all for today's session. Thank you very much.